My name's Dr. Sims, and I'm a gynecologist and a reproductive specialist. My practice is a clinical setting where patients come in on an appointment basis to be seen for reproductive disorders and general OBGYN. Our atmosphere is calm and relaxing. We encourage and motivate our staff to be friendly and always treat patients with the utmost respect. When dealing with reproductive disorders, diseases, and infertility, it can be very stressful and painful for the patients, so it is our job to help them go through this process and help them with other options or treatments that may be possible. Our main goal is to make sure that the patient feels comfortable and trusts the staff to help them. Pelvic inflammatory disease, also abbreviated PID, is something that we have been seeing more and more often over the years. Over the past year, we have seen this health problem occur 100 times per 1,000 patients. The symptoms of this disease are minimal, including bleeding and discharge from the vagina and pelvic pain. Oftentimes, however, no symptoms are experienced. As the infection spreads, the most common symptom is abdominal pain and possible fever. PID is a condition of inflammation involving some or all of the female organs within the pelvic cavity. It is often accompanied by pelvic pain and is usually caused by bacterial infection that spreads from other organs. Complications of pelvic inflammatory disease include obstruction of the fallopian tubes and infertility. Immediate treatment is important to reduce the chances of any complications. If not treated right away, PID can cause scar tissue in the pelvic organs and lead to infertility. To treat PID, I would prescribe antibiotics. These antibiotics are to be taken as directed and for the entire amount of time in order to be effective. As part of the treatment, it is important for the patient not to be sexually active until the infection is cleared. Lifestyle changes include using condom each time they are sexually active, and depending on the severity of the infection, the patient may need to stay in the hospital and get antibiotics through an intravenous method, and in extreme cases, surgery may be required to drain a pocket of infection called an abscess. The patient, whose name has been removed for privacy, is a 28-year-old Caucasian female. She is a middle-class working female who has had a rather healthy life. The patient's diagnosis is pelvic inflammatory disease. I have treated her with antibiotics and set up a follow-up appointment in 2 weeks. I also recommend that she stops using tampons at least until the infection is cleared up to risk complicating the current infection. Education and prevention for PID is essential to women, especially younger women. This is something that, if left untreated, could cause infertility. Therefore, we need to make sure that we are spreading awareness of this disease. Preventative measures could include media advertisement or social media ads to catch the attention of the younger females. As healthcare professionals, it is important that we understand the severity of this disease and do our best to catch these types of bacterial infections before they get out of control. It is also important to inform the patient of any changes that they can make in their lifestyles to reduce the chances of contracting PID again. The major problem that exists with PID are the public's lack of knowledge about this disease. For females, this disease could potentially change their future by causing infertility. So it is highly important that we take initiative and start educating females on how to prevent PID. PID is caused by bacteria entering the reproductive organs through the cervix. When the cervix is infected, bacteria from the vagina can more easily get into and infect the uterus and fallopian tubes. As part of our mission to educate women, it is important that they know that they are more likely to get PID if they have a sexually transmitted infection or an STI, such as gonorrhea and chlamydia, have bacterial vaginosis, have a IUD inserted, or have had PIDs in the past.